Welcome to Cocktoberfest, where we're not just raising awareness, we're raising, well, you know. Let's get to it. Welcome to Glow Up and Get Real. I'm Amy Ingle, the Sweet Face Injector, business owner, and trainer. Every week, we're injecting the latest on med spa trends, client concerns, and the boldest new treatments out there. Want the latest in safety, advanced techniques, and business strategies? You're in the right place. So, let's glow up, get real, and level up your beauty game. Welcome to Glow Up and Get Real. Today we're going to talk about Cocktoberfest and the advancements in men's sexual awareness. I have Adam Burner here, and he knows all about men and women's sexual wellness. However, we're going to talk about men today. Hey, Adam, how are you?
Wonderful. How you doing, Miss Amy?
I'm doing good. So it's October, but we're calling it Cocktober.
Why not?
that
make
was
it
that
fun
was your
and
idea.
memorable?
I want to
Yes.
say your idea, not mine, but very clever, very clever. So I want to begin by asking, what are the latest advancements in regenerative medicine for treating ED and Peyronie's disease?
Yeah, there's numerous things that are out there, and we're constantly evolving through the science and different studies and things of that nature. Yeah, we have everything from the basic. I think most people are positioning our platelet-rich plasma. It's kind of involves drawing your bloods, putting in a centrifuge, really grabbing those platelets to kind of reinduce those back into your own body to enhance that blood flow, circulation, anything to kind of get an extra boost into the mix that may be causing low libido or any kind of other ends of it where you're not getting that blood flow to make it available to perform upon delivery. So, and there's also shockwave therapy, different ends to kind of either combine or individualized approach is kind of how I like to present it, because everybody's different, right? So, from
Right.
your experience, you have people, has this just happened in the last month, or has this been like a 5-year ongoing on and off kind of thing that we're dealing with? Having those unique modalities to kind of play with. And, also, the realm of off-label, different options. Some people are utilizing fillers and, even exosomes and different things to try to attack that approach as kind of an additional enhanced option to be able to position to the clients.
Mm-hmm.
So, especially ones that may have not had previous, results or to their standardize what they expect. And I think, you do it great as a practitioner. I think set the expectations. This isn't a magic trick for any of these approaches, but kind of utilize different things and see what works and kind of advance upon that and get you back in action and feeling confident again. I think that's the biggest thing. Part of the reason I'm making it fun with Cocktoberfest, make it fun. There's tons. Probably millions of people that go through this every year, especially on their age and different ends that they're going through, that, don't be scared to talk about it. Ask your provider or ask this. You do a good job kind of promoting out like kind of group events and things to that nature, kind of elaborating on, the previous podcasts. It's in that get out of the comfort zone or get them into a comfort zone where they're not, kind of embarrassed, shamed about whatever's going through. Know these options are available and find the right person that has been doing this, knows what they're doing. Don't be scared to ask additional options as well.
Right. Yeah. And it is a serious conversation with my patients. I mean, they are very kind of timid and embarrassed to talk about ED. However, once we get the conversation going, they get very comfortable, and then they start sharing some of their issues that they're having. And you're right. It's taking that initial step to contact your provider that can help. Not all providers can do this type of procedure. The P-shot is what we're going to talk about mainly. However, you can start with your primary care doctor and they can refer you out, or you can Google. That's probably the easiest, because a lot of the primary care doctors don't know about these modalities with regenerative medicine.
Yeah, and there's educational courses and different ends of it that, thanks to social media, it's out there all the time and people are, promoting it. I see all the different promotions and ads running to strictly target, around ED, sexual wellness. I think it's more open friendly than probably 5 years ago or even a couple years ago. So, There's
It,
enough to kind of research around and different studies that people have kind of played around with, and even for practitioners like yourself, that don't know about it, learn, if it is something you want to get into, because it is kind of alluding to what you went. I mean, that's kind of why you started offering it within your practice, because there is a need for it.
yeah.
It's getting back to daily confidence and being back in action. You know, um,
Well, women talk. We
they
talk.
do. Yeah.
So, we hear my husband this, or, just all kinds of stories you hear. So I knew there was a need out there that wasn't being taken care of. So that's why I went and learned how to do these injections to help men and women with their sexual issues that they have, because it doesn't just affect them sexually in the bedroom, it affects them mentally so much.
Yeah, your daily routine, getting up, feeling confident, and having that additional weight on your shoulders, like crap, like last night, damn, being able to move forward your daily life, work, anything, it's a big distraction that there. I think even from ED to hair loss, even
Right.
and there's a lot of different sides of it, and I think taking that personalized approach, knowing what their background, what they tried, what they're doing, anything else, and I think packaging it accordingly to your client, whether it be adding a vacuum pump or anything into the mix with it. I think a lot that I see, I mean, I think it's a program it should be positioned around, because you got to get that blood flow back.
Right, right. And so many things can affect that in your life. Your lifestyle is a big one.
Yeah,
I mean, genetics is, yes, your age, of course, but lifestyle means smoking, taking medications, drinking. There's a whole slew of lifestyle choices that men make that affect their sexual wellness.
right.
And so you really have to address those and then figure out where to start and go with that with the treatment. Now, I know that you and I are very serious about this, but of course we have to laugh. Like we have to like throw jokes out there once in a while just to kind of, keep the seriousness a little light. So if you feel comfortable throwing some funnies out there, just go right ahead. Cuz
Oh,
I've heard a lot of your funnies as we've talked about certain things. Um
we have some
yeah.
funnies, and just so he knows, yeah, this is HIPAA. Like, we don't say individual or anything, but
No, 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 no. No.
yeah, it's always good to kind of share like what I see out in the field, like because I work with providers on a daily basis. I see what other people are doing and kind of the results, and I think that's kind of alluding to learning around the science, what other people are doing, and so
Mhm.
forth. But yeah, I have one interesting said he was getting decent results and ended up wanting to try something a little bit different, and he pulled me off to the side and his husband. So they, this is a highly gay community, and there's a definitely a need around that target area as well. The So he finished up, he used a vacuum pump and pulled me off to the side, and he's like, just so you know, I did it. And he's like, the tip, just the tip. He's like, the tip hit the top. And I was
Yeah.
like, wow.
So he did the
So
P shot. That's what you're
yeah,
talking about. Yeah.
yes.
Okay.
So yeah,
And we're
he
going to
just
talk about
finished
that here
up,
in a
add a
minute.
little bit more HA or something into the mix.
The hyaluronic acid.
So yeah.
Yeah. Okay. All right. Well, okay. So can you give us the elevator pitch for the P shot? What is it and why should anyone care?
Yeah. So, here's the deal. We're positioning this around a individual approach, using your own blood. What we do, kind of the breakdown, typically drawn out of the veins in your arm, spin it down in a centrifuge. So we're capturing those platelets to kind of reinvent them and reawaken them to the area that we're taking that approach. So, just slapping them up, really concentrating them down to target the specific area that we're having issues with or we're trying to address.
So you can use the patient's own blood, or you can also purchase the platelets from a lab, correct?
Well, or, there's different sources, autologous and allogenic sources
Hmm.
that people can utilize. Also, synthetic, there's different options to be able to implement that. So, most commonly from your own blood, which is autologous. So, we're taking that from you to you and just really driving it down, concentrating it. And depending on the factors that we're dealing with, there are other options that are a little more advanced to kind of help boost and stimulate and kind of renew that area of functionality.
So what do the platelets do? I mean, I
So
know because I do this, but I just want everybody to hear your side.
yeah, Yeah, so they are, depending on, like you said, lifestyle, different things, they can get lazy. So, yeah, it's kind of splashing cold water on their face, getting them back to work, but really concentrating them instead of being all over the place. So we're really, you know, putting them together on one specific power punch. It's called SEAL Team 6 and go to work and kind of,
SEAL Team 6.
yeah. So
Nice.
your job is to go in, you got a specific duty, and, you know, whatever we can do the best of our ability to make it as potent as possible and get to work in that specific targeted area instead of just running the streets.
So the platelets actually, when you inject them into the penis, and that's where it goes,
Hmm.
which we're going to get to next about how that happens. So when it goes in, the platelets then scatter into the cavernosum of the penis, and it stimulates collagen and neogenesis, which is repair blood vessels. It also helps with inflammation, decreases inflammation, increases, doesn't it increase nitric oxide as well, which is pertinent for treating ED.
Yeah, it potentially does have, you know, based around, you know, studies and different things. So there's a lot of great benefits. And I'm glad you brought that up with the collagenic factors and different ends to help re-stimulate. Yeah, especially the blood flow. I think is, you know, you could have calcium buildup or plaque or something, plaque for the most part. You know, kind of really breaking up that area of blockage that's preventing that flow from going on.
Mm-hmm. So, for someone who's nervous about needles down there, how do you help them get comfortable with the process?
I don't specifically, but
Okay.
you know,
All right. What have you
you
heard
can
other providers
you
are doing?
can you can flick the tip. Just kidding. So
Here comes the
typically,
funnies.
you know, numbing and different aspects of, you know, because it is a sensitive area, and I think probably from a guy's perspective, it's like, holy crap, you're going to take that and put it there.
Mm-hmm.
So yeah, just my feedback and everybody, you know, because initially I'm just like, damn, that sounds painful, or it can be, you know, a little bit kind of scary.
Mm-hmm.
Yeah, again, going to the right person, doing the right thing, feedback that I'm getting across the board, I mean, they don't even feel it.
Yeah.
You know, having that comfort zone in between as well to kind of put them at ease and share the previous experiences that the other patients have experienced themselves and their
Mm-hmm.
feedback. And if it was very painful, they probably wouldn't be coming back and seeing you every 2 months, 6 months, whenever that starts to digress again.
Mm-hmm. Right. Exactly. I have multiple repeaters, and it's yeah, that it's not as bad as you think. I know that for the first time, men are really terrified.
Yeah.
But I use a really good lidocaine gel base and leave that on for about 20 minutes, and that usually takes the bite out of it. So, my clients, they hardly feel it, and they're actually surprised as well that it's not
And I
painful.
think that's the thing too is, yeah, it's like that initial kind of fear factor kind of end of it. But once you, you know, dip your toes in it, it's, yeah. And I think that
Right.
too is having those stories to kind of share. That's where you're going to get your referral base. And probably you experience that is be like,
Right.
hey, dude, yeah, just like women's drink, women drink or whatever. I've heard men talk about it as well. You know,
Mm-hmm.
they go out and, yeah, kind of open up and stuff. And I think more just, you know, making that comfortability and kind of understanding it and positioning it the right way.
Right. Right. So, are there any myths or wild stories about the pea shot disease, or well, the pea shot or Peyronie's disease treatments that you'd love to debunk once and for all?
Yeah, I think number one probably is super painful.
Okay,
Yeah, I
so we
think
just
that's
talked
one of the
about that.
ones, and I think yeah, going just to kind of reiterate that, but yeah, some of the myths, depending on how you're promoting it, don't overpromise, underdeliver. So
Hmm.
yeah, this is going to increase your girth by, you know, you're going to grow 3 inches. You know, it's just some of the silly marketing to draw that attention to get people
Hmm.
in, but
But can happen. It can
it
happen.
can, yeah,
Hmm.
it can, but to position
I
it
think it's like
again.
60% of men get that increased girth and length.
Yeah, just kind of my funny story about he's like, I use the vacuum pump, and he's like, did this time, and the tip hit the tip or the top of the pump. So
I've heard that before too.
it is possible.
It
So
is
yeah,
possible. Hmm.
so
It
and
does
then
happen.
and I think you know a lot of it too. There's still the bunkers out there that, you know, there's no science. Again, this is regenerative medicine. The science is consistently going. There are studies. There are different things that people have shown where this is beneficial
Yeah.
to be able to assist in overcoming uh, whatever you may be dealing with. Yeah, there's a lot of different researches. There's courses and things of that nature that you can utilize, even though most are off label. But again, with it being that side of it, just know you're going to the right person that has a background that's been doing this, knows what they're doing, and can share testimonials or patient feedback directly. Uh, Put them at ease on it. Yeah, I think also too probably the myths are just, I wouldn't say really like a myth. I think it's just more of kind of presenting like, hey, this is a magic trick. Yeah,
Mhm.
all you need is
Mhm.
one, come in, cool, you're good to go. Yeah,
Mhm.
it could be a couple different sessions. Follow up like in a month, or I know your time frame kind of varies. Depend, and a couple come back every 3 months, 6 months, or whatever. Just kind of with anything, test it, kind of, you're kind of testing the waters and kind of see what the reaction is and how to
Mhm.
kind of make that as a individual approach moving forwards.
Right.
There's
Yeah.
plenty of information out there too for people to research themselves, and yeah, just trying to figure it out.
So, how do results from the P shot compare to more traditional treatments for ED? We think about Viagra, Cialis, that so many men are on that. However, a lot of men don't like being on it. They don't like taking it. It's burdensome to take, to think about it. And if you have a cardiac issue, that might not be an option. So, how do the results compare between something like that when you're doing the P shot with the platelets?
I think you're positioning it more as a holistic approach, number one, and then alluding to the potential side effects. Dealing with the Viagra, Cialis, and different ends of it. I mean, not specifically, but I know some people, it causes migraines. It causes
Mhm.
other effects that, for that blood constriction. So, um, you really versus something sublingual and your body's absorbing or whatever. We're kind of getting to the root cause of what we're trying to accomplish.
So, what's the typical patient journey from the first consult to post treatment?
Yeah, there's one positive side on the feedback and everything. There is really no downtime, so it's not like any of these. Um, it's not like you're going into plastic surgery. You're going to be out for 2 weeks or whatever the case may be. So yeah, the journey is doing a consultation, understanding the approach, and what really the you yourself and whoever the provider may be, explaining that here's what we do, to numbing it, to going through the whole approach. And then based on your feedback, I would, you do a good job too, is 3 to 5 days after, give it some time, get to work. Not a magic trick that expect 30 minutes you're going to walk out of here and have to hide. The
Yeah.
Yeah, just see what their feedback is, how everything's going, and then do probably another week follow up, and then it may be another round, and just give us some time to let your body do its own thing.
Yeah. How I consult with my clients is that when they come in, we do the procedure. Um, I tell them that after the procedure, they have to pump with a penis pump. The protocol is about 10 minutes, 3 times a day for 12 weeks. And that seems like a lot, but it does make a big difference. I've had clients that have not pumped, but maybe a couple of days, clients that pumped for a month, and clients that pumped for the 12 weeks. And I
Consistency.
have consistency, and I have seen a huge difference, much better results when they follow that protocol of pumping. I also tell my clients, as soon as I finish the injections, I encourage them to go pump, and they are free to do whatever. I mean, they can go and have sexual intercourse that day. There's, like you said, no downtime, and it actually helps with the flow and to kind of stimulate those platelets to regenerate in those areas. It does take 90 days for platelets to regenerate. So I do tell them, this may be a little waiting game, but most of my clients, they get results like within the next couple of days. They see a difference.
That's fantastic. And I think
Yeah.
too, yeah, alluding to that kind of protocol system that you have, getting that blood flow. It's kind of cliche, but if you don't use it, you lose it. So if
Mm-hmm.
you're just going out and doing it and you're not getting that, don't expect, hey, a month later I started dating or anything like that, and be good to go if you haven't been, getting that blood flow in action, to be to be prepared.
Right.
So, I mean, that's the
Right.
key, I think, to consistency as well. Because if you're just doing it just to try it out, you got to reawaken and get everything else
Mm-hmm.
together and synchronized function.
Yeah, I think that's important that they follow those protocols. It's really important. I know how I have always done my injections. I do a 5 point injection. I do two injections on the side, lateral of the penis, and I do one at the tip, just the tip,
Just a tip.
just the tip. And I just make sure that my concentration of platelets or Wharton's jelly, whatever I use, is more concentrated at the tip. So I focus more. I do less volume, but I do more concentrate at the tip, and that gives it more sensation, which actually stimulates everything else to happen, right? And I found that that really works well. So, have you seen any surprising or funny success stories from your patients, without naming names, of course?
Um, just so talk to my I get a friend, her husband. I was like, dude, you should try adding some of this into the mix. The 40s, yeah, not they're healthy, good, and yeah,
Adding
he
what?
ended up
Adding what?
doing a pea shot.
Just
So
okay, just doing the pea
adding
shot.
into
Okay.
it or whatever, and
In their spa, in like their medical spa,
oh,
adding as a
outside of this
service.
is just like a personal one that went to one of my spots to do it, and this
Okay,
was their personal feedback. So
gotcha.
it was funny. She sent me like a laughing emoji 2 days later, and she's like, "He was up all night." So I
Uh,
was like, "Well."
sorry,
So she's like, "I'm not
sorry.
complaining, but yeah." I was like, "Just so you know, it works."
Yeah.
So, but yeah, so you know, and every individual is different on that side, but it is something that we have available as tools to address those needs that there is a big need for it, and I think
Hmm.
health wise as well, we can go into health, like what are the health benefits of being able to have a healthy sexual life, not only daily function but mentally and even physically part of it as well.
Hmm. Yeah, I think that's important. What's coming next in regenerative medicine for men's sexual health?
A lot of cool stuff, I think, on the horizon. So, it's constantly changing, talking to different doctors, seeing different protocols of different ideas that they're putting together and suggestions. So, I really think with a lot of, more people being comfortable offering this service and getting the right training and doing things, more people are sharing their results amongst each other and kind of figuring out the right protocol around different ends of it. So,
Hmm.
whether it be, who knows, open up to different stem cell therapies, cellular tissue models, platelet derived growth factors, or just different ends of it, either solo or combining them, to really kind of figure out the right mix for the right individual and being able to have those options. And then you have the peptide realm as well, where there's additional realms that you can utilize those in conjunction.
Hmm.
Make it a personalized approach, not one shot magic
Hmm.
tricks. So depending on the patient too, your platelets may not do anything.
Well, and it
Yes.
depends on the provider because it depends on their injection technique and also depends on what products they're using. If they're using just ontologous, just like the patient's own blood, or are they adding to that? There's a lot of factors. And then of course the factors of the client, like their lifestyle, like we talked about, and their genetics and their age. There's so many factors. So everybody gets a little bit different reaction result from these injections.
Yeah, and I think too, you hit the nail on the head with talking about you know the post ding dong.
Nail on the
uh,
head.
but talking about a so many clinics I just see promote LP shots. Why
Yeah.
is yours different? Why is our we have a protocol, unique approach to make it personalized, because we have this to go along with it to make sure that we're given the best options and the right tools to make this successful, as successful as we can.
Hmm.
Whether it be the penis pump, whatever the case may be, those are different ends that I really don't see a whole lot of people positioning as a complete package approach
Hmm.
that are crucial to helping achieve the best outcomes or optimize the results around it.
Right, right. Yeah. Okay, so my last question. What's your sweetest tip of the
The
day?
sweet,
Just the tip.
Just the tip. So there's many tips, but we'll just yeah, I think sweetest tip is knowing your provider, do your research, understand the whole process, and um, really go in confident, feel confident going in that you have the right person doing the right piece to it. And there are people that one doctor, he's like, I saved more marriages than Dr. Phil.
Mm-hmm.
So, having that confidence and being able to talk it, even bring your partner together with you and kind of address that side of it. So, it from both ends and not like you're, going undercover, hiding in a coat so nobody can see you. So
Right. Right. Yeah.
it's, but make it
Yes.
fun, talk about it and collaborate. It
Yeah.
shouldn't be like a
Don't be afraid.
hidden, it couldn't be a hidden issue or anything of that nature. I know it's the embarrassing approach and, confidence side, but hey, get rid of the embarrassing side of it, overcome
Mm-hmm.
that, because the longer you delay, the more you're going to feel miserable, lack of confidence, and
Mm-hmm.
not feel healthy and happy.
Right. Right. Exactly. Well, is there anything else you'd like to share?
For this one,
Shouldn't have asked.
I would, one thing is, I will say with Amy, you are fantastic on how you present everything and
Oh,
constantly kind of,
thank you.
sharing ideas together and different approaches to different things. And, reach out to Amy, Sweet Spot Medicine, if you're in the Fort Myers, Naples, Cape Coral area, even Sarasota. But also, too, I want you to talk about Amy is going to start opening up her aesthetic training programs. So
Mm-hmm.
for advanced treatments, if it is something to any of you out there listening that you're interested in, want to learn more, these are for provider specific or even, you know, outside community educational. You guys to come in, just sit down, kind of ask questions and do everything.
Right.
I really love what you're presenting and putting together because
Thank you.
you can help out on both ends of it. You
Mm-hmm.
know
The
your
face
stuff.
and the body.
Yes.
Mm-hmm. The
Yep.
face and the
Then,
body.
so what are we doing
All right.
next?
Oh, goodness. What do we want to talk about? We could
Go
talk
to
about women.
Cocktoberfest to
November. Yeah.
November to remember. Let's go
November to
into,
remember. Yeah. No.
let's
Yeah. I
get the
think women's
women's
health.
point of view.
Women's health would be great. We'll talk about sexual rejuvenation with women.
Yeah.
I like that. I see a lot more women than I do men because I think because of the embarrassment factor, women are more apt to talk to another woman where a man is not as easy talking to another woman, I think, about their sexual issues. So let's do that. Let's talk about that. That's exciting. And then if anybody has questions about your regenerative medicine that you provide, like I buy my regenerative medicine through you, how can they get a hold of you?
Yeah, you can email me at evolve@phoenixregen.com, or you can reach out directly 321-356-3855.
Okay. Thank you for joining us on the Glow Up and Get Real podcast. Here's to fearless beauty and real talk. Until next time.